Wellness Health Services. I'm Dr. Joshua Dirito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at balancing spirituality and modern healthcare. We are looking at a holistic approach to patient care. So, spirituality plays a crucial role in our healing. Modern healthcare often focuses on physical health, but integrating spiritual care enhances patient well-being. We have made big advances in the technological aspects of taking care of the physical health of individuals. But we often forget as healthcare providers that health is not only the absence of disease, but it is a complete emotional, spiritual, and the psychological well-being of an individual, according to WHO definition. So we cannot ignore the aspect of spirituality in healing, because spirituality provides comfort and hope. It enhances resilience in illness. It supports mental and emotional well-being, and it encourages a sense of purpose and meaning. Spirituality helps one to be joyous, it helps one to be connected, and it helps one have a reason for living. So the modern healthcare approach. Scientific advancement focus on evidence-based treatment, which is the core of the practice of medicine. Technological innovations improve diagnostics and treatments, which help to diagnose disease, make timely treatments, and also help individuals to know what is physically ailing them. Then we have developed standardized protocols to ensure safety and efficiency. And then there's a lot of emphasis on measurable outcomes. But we fail to look at the impact of our health on our spirituality on our physical health. So what are the challenges of integrating spirituality in our healthcare? The healthcare providers do not have training on the aspects of spirituality. Sometimes there is a potential conflict with medical ethics. But talking to patients, like asking them what gives them hope, what gives them connectedness, then it helps patients bring out what they believe in and what is the core of their life. So diverse spiritual beliefs among patients also makes it challenging for health providers to know where to support. Sometimes we may not be conversant with some of the spiritual practices of our patients. Then the issue of time constraints in the clinical practice. You don't have time to ask about the spiritual connectedness. I was watching a video of an anesthesiologist who was to see patients in primary care. For those who may not know, anesthesiologists are those doctors who give sleeping medicine to patients during surgery. And so here he was, a person who is used to giving people sleep using medicines. And now here he sits in a general practice session, and patients are coming to him. They have sleep difficulties, and in his mind he's thinking, the easiest way is to give an injection, and within minutes the person is asleep. But of course, this is a knee-jerk response to the issues that the people might have. And so these are some of the challenges that we have. We are not trained to sort deep emotional and spiritual aspects of a patient's life, which we might not be very well prepared for. So how well can we be able to balance both the practice of medicine, physical health, and the spiritual health. Respect and acknowledge our patients' beliefs. And as I've said, it's always good to ask our patients what keeps them connected, what are their beliefs. It is important to integrate chaplaincy services with patient care and also connect patients to chaplaincy and also to spiritual advisors. Then it is also important that we train healthcare providers on spiritual care. Individuals are spiritual beings in a human body. Then it is important that we encourage holistic, patient-centered care. You cannot talk about treating someone physically when they have spiritual issues, they have emotional issues, they have psychological issues. Sometimes a good percentage of patients who present with physical symptoms, their underlying conditions could be psychological, they could be emotional, they could be spiritual. And this is why in family medicine we talk of comprehensive care, we talk of holistic care, we talk of patient-centered care. These are some of the principles of family medicine. Then it is important that we foster interdisciplinary collaboration so that you work with the others to be able to help patients. So a holistic healthcare approach improves patients' outcome. It has been shown that patients whose all aspects of their lives are taken care of have better outcomes than those whose only physical health is taken care of. Healthcare providers should integrate spirituality respectively and get conversant and train themselves to deal with matters spirituality. Future policies should encourage and support spiritual awareness in medical setting. If you like this video, please subscribe to the Overall Health channel and share some of the ways you have been able to share issues of spirituality with your patient. And if you are a patient and you have been able to navigate your spiritual journey with your health, you can also share with us how the health providers assisted you in a comprehensive and holistic way to navigate your health journey. Thank you for watching.